Last year in this House, our thoughts are, of course, with each and every one of you at this very difficult time. Last Friday, we decided as a government that we can proceed with phase 2 of our roadmap, and we could also bring in some additional measures. As always, our decision was informed by the data on the status of the COVID-19 disease in our country and by the public health advice that we received from the National Public Health Emergency Team. As part of this phase, we can now meet in our homes in groups of up to 6 people, and we can strengthen again the private bonds that hold our society together. A maximum of 15 people can now meet outdoors for organised sporting, cultural and social events, and through this we can begin with caution and care to rebuild the public life of our country. The number of people that can attend funerals and cremation ceremonies has been increased to 25, an important issue many colleagues here in this House raised with me. The inability of friends and sometimes of family to be able to stand with those most directly bereaved at a funeral or cremation service has been one of the most difficult and painful aspects of this pandemic. Our communities found thoughtful ways to show their support and solidarity to those who are mourning despite the limits, and it is our hope that the extra number of people that can now attend these services will provide further comfort at such a sad time. We have now clearly moved as a country from a message of stay home to stay local, which means that we're asking everyone to remain within 20 kilometres of their home or within their county boundary. We are able to make this change because our collective actions as a country have managed to suppress this virus. But we absolutely must remain cautious, and we must continue to restrict our movements as much as possible so we do not lose the hard-won progress that we've made. I would like to inform the House today, as I do every week, in relation to the OR number. I have been advised by the chair of the modelling group, Professor Philip Nolan, that the OR number is estimated to be between 0.4 and 0.8. I'm told by Professor Nolan that we can be confident that it remains below 1 this week, and I'm also very encouragingly told there's no evidence that it is increasing or indeed decreasing, but that it is staying remarkably stable. Again, a testament to the huge efforts of people in this country. We have continued to also see a reduction in the number of patients with COVID-19 in our hospitals, with a welcome fall to 75 people in Irish hospitals today with COVID-19 confirmed in the latest published numbers, and 29 people in our intensive care units. And of course, I'm conscious when we quote numbers, behind each of these numbers is a patient, is a person, is a loved one, and we send each and every one of them our best wishes, particularly those in ICU, fighting for their lives, and we look forward to more people being successfully and safely discharged from our intensive care units. This is a trend we have to maintain, and I would suggest that there are 6 key ways in which we can all help to do that during this new phase. Number 1, close contacts. While we are obviously now able to meet more people again, and this is great, something we've worked very hard for, we've missed people, we've missed family, we've missed friends, there is absolutely a responsibility on every single one of us to minimise the number of close contacts we meet. Now is not the time to be increasing your social circle. Now is not the time to be meeting your second cousin once removed. Now is a time to think, who are the core contacts that I've really missed in my life? Who are the couple of key family members or key close friends? And they're the people I'm going to see, and I'm not going to see people beyond that socially for phase 2. I'm also asking people to keep a list of those you've met for contact tracing purposes. So if somebody, God forbid, gets COVID, have a list, jot down a note, put it in your phone, whatever, of the people you met today, so that we can very quickly contact trace anybody you have come in contact with. Second point I want to make is that outdoors is better than indoors. While the guidelines do now provide for indoor visits, and in the Irish weather that's perfectly understandable and possibly necessary, I do want to encourage people to remember that meeting outdoors does entail less risk, and it is a better choice. And even if you're meeting indoors, meeting in a well-ventilated area does lessen your risk as well. The third point I want to make today is about self-isolation, and this is a really, really important point. Irish people, as we heard Professor Killian de Gascon say in this chamber during the week, they're really good for going to work when they're sick. People get up in the morning, they have a temperature, they have a bit of a headache, they take 2 paracetamol and off they go for the day. We need that habit to stop. If you feel sick, we need you to immediately self-isolate if you have any of the symptoms of COVID-19. Don't put it off, don't wait, and don't hesitate to contact your GP. Because we have seen, and this is one of the concerning trends we've seen in the last week, we have seen a growing number of household clusters, and that is concerning. They're small numbers so far. I think it was 6 one week and 16 in the last week. But that does make the advice in self-isolation even more important. We don't want a man or a woman in a house to feel sick, to delay self-isolating within the house, and by the time they actually contact the GP, now all of a sudden 2 or 3 people in the home have COVID-19. So the self-isolation advice is very important. The fourth piece of advice relates to 2 metres. As we begin to move around a little bit more, the importance of social distancing remains high. In fact, it's more important than ever. I know the Oireachtas committee today heard from the World Health Organization, and the message is clear. Social distancing, staying apart, saves lives. Now, people can have the debate about 1 metre, 2 metre till the cows come home. The reality is 2 metres is safer than 1 metre, and the public health advice is 2 metres. So in your social engagements, to keep that 2 metre distance will help save lives. Continuing to control this aspect of our personal behaviour will be essential to controlling the behaviour of the virus. My fifth message is to stay local. We are now thankfully seeing a number of counties in Ireland who have not had a confirmed case of COVID-19 in quite a few days. Before Deputy Fian rises to remind us about Sligo again this week, I think Sligo is a county now that hasn't seen a case of COVID-19 in 3 weeks. There are others beginning to get there. I think Kerry hasn't seen one possibly in 3 weeks as well. I'm going from memory. But there's a couple of counties that haven't seen a case in 3 weeks. There's some counties that haven't seen a case in 2 weeks. And there's a number that haven't seen a case in a week. This is good. This is real progress. But it's so important that we use phase 2 to continue to weaken the grip of the virus. And we're asking people to stay local, stay within your own county, to limit the potential for the virus to spread or recede across our country. The sixth point I want to make is just in relation to face coverings. And I want to be crystal clear on this. When it comes to the issue of face coverings, from a public health point of view, it is the clear public health advice you should wear them on public transport and you should wear them in enclosed indoor spaces like shops. We will be launching a further public awareness campaign on this very shortly. People ask me, are we going to change the law in this regard? And we don't have plans to change the law. But we didn't change the law either to say you needed a cough into your elbow. We just got used to it. We didn't change the law to say we wash our hands for 20 seconds, but we got really good at it. We haven't even changed laws in relation to 2 metres on occasion. So this is about behavioural change. And I accept that the evidence and maybe even the messaging on this has changed over time. And perhaps it's been confusing for people and perhaps it hasn't gotten through in the clear way it needs to. So let's be very clear, starting from today, very, very clear. Face coverings are recommended. You should wear one on public transport. You should wear one in shops and in other enclosed areas, unless you have a medical reason not to, or you're under the age of 13. And I think that's an important message. We all need to come together and get out, and government has a role to do, a big role to play in terms of a public awareness campaign in relation to this as well. And the final point is the hand washing and the cough etiquette. I think people are more than familiar about this. We've gotten really good at this, but it can't be said often enough. In phase 2, this will be one of the most important behaviours we can embrace to protect ourselves and each other. The virus can live upon our hands. If we wash them regularly, wash them frequently, it makes it much harder for the virus to survive. These are the simple, basic, important things that we can all do to stay safe, whilst we try so hard to find that balance, to find that sweet spot, a way of safely living alongside the virus. Whilst we're working to get the numbers down, we're working to get as close to zero as possible. Whilst the virus is still here, we have to try and get back to some degree of normality. And that requires us all working out a way to safely live alongside it. We have all been particularly mindful of the impact of this pandemic on both children and older people during the earlier phases of the response. And it's very welcome that NEFID was able to recommend measures to hopefully make life that little bit better and that little bit easier for these two groups. The protection and well-being of those in our nursing homes continues to be my priority, as it should. For that reason, I'm particularly pleased that our success in pushing back the disease has allowed us to bring forward to the 15th of June the phased resumption of indoor visiting to residential care facilities. This has to be done safely. Normal nursing home visiting is not coming back next week. And I know nursing home owners would want me to say that as well. What we are trying to do is see if we can enable, on compassionate grounds and understanding and the fact that people are lonely, a degree of visits coming back. It has to be done safely. It has to be done aligned with the guidance. And as I've said to a nursing home owner, I'd much rather be standing here defending you for not allowing a visit next week than explaining why a cluster was allowed to break out in that nursing home again. So we need to proceed with caution. I know people are dying to see their loved ones. I fully get that, but we've got to get this right as well. Finally, I want to say today, planning for the delivery of non-COVID care is well advanced. The HSE CEO has confirmed to me that a framework document will be published by the HSE next week. The reintroduction of services will be across acute hospital and community settings, and they will plan for the reality where we have to treat both COVID and non-COVID patients simultaneously in the context of heightened safety concerns. I know colleagues in this House have been particularly concerned about the restart of screening services, as have I, and I'm pleased to say that the HSE has confirmed that there will be restart dates for each of the 4 programmes by the end of this month. We are making great progress as a country. We should be proud of the collective contribution every citizen in this country has made, but we must continue to be cautious. On the 5th of June, the Director General of the World Health Organization said that for countries that have seen reductions in the levels of the disease, the biggest threat now is complacency. As much as we would wish it, we cannot now decide that we've done our bit and the threat is gone. As a country, we've suppressed the virus because of the willingness of the majority of our population to change their everyday behaviour and to maintain the change. That remains our massive ongoing challenge now, Ciara.